My name is Scott Brigger. I grew up here in Hutchinson, Minnesota. I was diagnosed in February 24th, 2012 with stage 3C colon cancer. Finding out that I had cancer was life-changing. I started to look at life differently, starting to understand that I did not have control of when I was going to die.
When they first come, I know that they're extremely nervous, and this is a new diagnosis for them. And the first thing that I want to do is make that first day the easiest and the most comfortable for them. And when they leave that day, I want them to know how to take care of themselves, and I want them to know that we are here for them 24/7.
The nurses and the doctors here at Hutchinson Health are just outstanding. I cannot say enough good things about them. They are comforting, they are soothing, they are very thorough, they are very heartfelt about how they carry on with patient care. They really are looking out for the best interest of the patient.
Having a cancer clinic in Hutchinson means that patients don't have to go to the Twin Cities or other metro areas that would have to take over their care. We are able to do a lot more focused care close to home.
Cancer patients, once you have treatment, really are wiped out, tired. They just want to go home. They want to be normal. They want to have maybe a comforting feeling when they go home. It was very convenient, very nice that I only had to drive 10 minutes across town to get there for my treatment.
I think our biggest challenge is our space. There are days where we don't have room to do our patients' treatments.
So we could have up to 5 adults plus Dr. Campbell at an office visit, and it's very, very difficult to get all of them in that small exam room. And the office visits for a new patient could last up to 3 hours. So it's very uncomfortable to have 6 or 7 adults in that very small room.
In the new cancer center, we're going to have a lot more space that allows us to encompass a whole family, and we would be actually able to encourage more family members to come with for office visits, especially for consults.
We're going to have a much larger waiting area for them, for patients that come often with wheelchairs. It's hard right now to get them in and out of that small waiting room with the doorway the way it is and the way the chairs are.
Our new space is being designed specifically for our chemo patients. Our rooms are all designed, how we want them set up for our chemo treatments.
Currently in our cancer clinic, we have to go to lab, which is down the hall, and for a lot of patients it's a lot more difficult for them to get down there and to get moved around from one place to another. And with the new cancer center, we'll be able to bring everybody back into one area, and the bone marrow biopsies and the lab and any procedures that they need can be done right there in the cancer clinic.
And so it'll be great for the patient just to have that experience all in one location.
Our new cancer center, I think, is a great leap to that perspective, even from an oncology perspective, that we could get additional staff employed in the future.
And I think one of the ways that our cancer center can continue to grow is by getting donations from people. And we never know when we might be one of those people that needs that extra care, that extra room, that extra treatment. And I think that the donations will definitely help everybody in the community.
I cannot think of a more worthy cause to donate to. This is really touching home. This is about our family, our patients.
When you're diagnosed with cancer and you go through treatment, the hardest part is anytime you walk in that door, you might have cancer. Doesn't matter.
Thank you for your support.